This video is about cat spays. So I'm going to describe to you how it is done live. A cat spay. This is the surgical removal of the uterus and the ovaries of a pet. It is also known as Ovariohysterectomy. There are several facts about a cat's reproductive potential that makes it necessary to have them spayed. Cats reach sexual maturity by the time they are 4 months old. 2, after giving birth, they can reconceive in as early as 2 weeks after they've given birth, even if they are still nursing their kittens. Then in terms of heat, undergo what we call induced heat, which can occur every 2 to 3 weeks. This induced heat is triggered so long as the tomcats are around. Queens can also continue reproducing well into their senior years, and then the litter sizes range from 3 to 5 kittens, and sometimes this may go up to 10 kittens. Because of these facts, it's essential that as often as possible, cats which are not meant for reproduction be spayed as early as possible. Usually, cat spays are done by the time they are 4 months old. At this age, they are old enough to be operated on. Because of the previous facts, cat spays are necessary: 1, for the reduction of stray cats in the community; 2, to reduce financial burden on the owner; 3, to ensure adequate food provision, since having fewer cats allows one to easily provide for them. 4, cat spays also ensures reduced likelihood of inbreeding. And then the 5th necessity, it has to do with pyometra, a lethal condition whose treatment is through definitive ovariohysterectomy, except in cases of open pyometra, where medical treatment can be instituted. To the operation, the cat needs to be starved for at least 8 to 12 hours, but water can be given at any time. Then in some cases, especially in old cats, liver and kidney function tests may be indicated to ensure that they are well enough to go under anaesthesia. And then prior to the operation, a day before, they have to be kept enclosed to help reduce stress levels, etc. Prepare the cat by sedating it with any pre-anesthetic like sterilizing. Once the cat is sedated, put the cat in the right lateral recumbency, ensuring that the left flank is facing upwards. Clip off a fur from the caudal edge of the last rib, extending to the peritoneal aspect of the knee joint, and then from the top reaching up to the bottom edge of the knee. Cleanse off the surface, use some antiseptic like Ligation, which can come in form of Savlon. Dilute it to a ratio of 60 to 90 ml in 1 to 1.5 liters of water. After that, you can give the cat the anesthetic to knock the cat out completely. After draping off the area where the surgery will occur, you can spray some methylated spirit on the surgical site. Then mark off the area where you are going to make an incision. Basically, you can use 3 landmarks: the coxal joint, coxal tuber, the top end of the ischium, and the third finger on the surgical site. Make a skin deep incision to cut through the skin and fat tissue. The length of the incision can be the length of the smallest finger at the first phalanges. After the incision, use the right forceps to lift the muscle tissue and then incise through it till you reach the external abdominal muscles and the internal abdominal muscles up to the point of the peritoneum. When you reach the peritoneum, you can nick it whilst lifting the muscle. You can nick it using a blunt forceps to enter the peritoneum. After reaching into the abdomen, the next method is to retrieve the left ovary. So in some cases, you would find the ovary just at the surgical site. In certain cases, especially if the cat has given birth multiple times, you find the ovary situated in a different location. So you can use a spay hook or a blunt forceps or your little finger to try and localize the ovary. So the safest is to use a little finger, so long as your hand is small enough. In certain cases, you can extend the incision to assist you in visualizing the surgical site. In case of pregnant queens, this will be very easy to localize. Then in such a case, you can retrieve each area of the placenta, each area of the amniotic sac, one by one till you reach the ovary. But in this case, you have to increase the surgical site, otherwise you may end up tearing through the amniotic sac. So it's more difficult in cats which are non-gravid. So after After retrieving the ovary, you need to place a ligature using absorbable suture material like polyglycolic acid or polyglactin or surgical cut 3 or 3.5 metric in size. So the ligature has to be placed beyond the ovary just at the ovarian vessels that attach from the ovary to the left kidney. So you can place 2 or 3 ligatures to help prevent bleeding once the ovary is removed. So the ovarian vessels are localized beyond the, we can say, cranial to the ovaries and extend to the kidneys. So in our case, we are putting 2 ligatures. Ensure that you leave a bit of space between the ovary and the first ligature, because that's a point where a clamp will be placed and beyond which the ovary will be cut off from the blood vessels. Make sure that the ligatures are firm and make at least 2 to 3 throws. So after applying the ligation, after ligating the blood vessels, you can clamp between the ovary and the last ligature using an appropriately sized curved forceps. So you can put 2 clamps, one between the ovaries and then the other one distal to the ovary at the neck of the fallopian tube. So after clamping, follow through from the left ovary to the fallopian tube on the left till you feel your hand reaching the bifurcation. Then you can use your finger to then reach the second ovary in the right or the right ovary. Otherwise, you can still use the Spay hook as a guide. After localizing the right ovary, we can place similar ligatures beyond the ovary at the ovarian vessels. So we can place 2 ligatures ensure that the knots are secure, but it shouldn't be too tight as to cause the blood vessels to crash. So after ligation, just like in the other ovary, clamp off at the point between the ovary and the ligation. And then if you can, you can also clamp off the caudal edge of the ovary at the neck of the follicular. At the neck of the fallopian tube. Then afterwards you can excise off the ovaries from the blood vessels, the ovarian blood vessels from both sides, left and right. After severing the ovary from the ovarian vessels, hold the end of the ovarian vessels with another clamp below the clamp, and then open up the clamp to try and see if there is any bleeding from the surface. If you notice any bleeding, you can place some more ligatures, one more ligature beneath the initial ones to try and prevent any extra bleeding. So you can do the same on the other ovary which has been clamped off. So cut between the clamp and the ovary, and then holding, get another forceps or clamp to hold at the bottom, and then release the clamp to check if there's any bleeding. Similarly, if you notice any bleeding, add extra ligatures. After checking, you can push back the severed ends of the vessels back into the abdomen one by one, so that you just remain with the fallopian tubes and the cervix. Tap off any extra bleeding from the surgical sites. So the next thing to do is to put ligatures as far as possible near the cervix. You can do this either directly or by first clamping off the cervix. So in cats, you don't need to actually reach the cervix, so you can just clamp off as far as possible the uterine tubes. After clamping, then you can place ligatures and tighten up to a position where the clamp was after loosening it. Otherwise, you can just ligate directly. So you can place 2 or 3 ligatures on both uterine tubes or at the cervix. After placing the ligatures, you can now clamp just above the last ligature. And then excise at the top end of the clamp to remove the uterus together with the severed ovaries. Then what you do, check for any bleeding from the clamped end of the cervix. Hold beneath the ligated area using a curved forceps just on the side, and then loosen the clamp on top slowly and check for any bleeding. If you want, you can secure off the open end with some suture pattern to close it off completely. After unclamping and checking for any bleeding, if there's no bleeding, and ensuring that there's no attachment to the side of the abdomen, you can push back the cervix back into the peritoneum. So the next procedure will be to oppose the external and the internal and the peritoneum. External abdominal muscle, internal abdominal muscle, and the peritoneum as a whole to its from both ends. You can do this using absorbable suture material. When taking bites into the muscles, ensure that the layers are lifted off the bottom to prevent any accidental pricking of the organs in the abdomen by the surgical needle. So oppose of the area to ensure proper healing. So to ensure proper healing, you have to include the peritoneum. There are times where the peritoneum has torn off. So what you need to do is you have to ensure that when you take a bite, make sure you localize where it is and then pierce through it. Including the peritoneum is what will help the wound to heal well. So after apposing the muscle tissues and the peritoneum, using simple interrupted suture pattern with an absorbable suture material like PGA or cut or any other absorbable suture material, the next thing is to do a subarticular suture pattern in the subcutis. This can either be interrupted or continuous. So as usual, use the absorbable suture material. Then oppose the skin with simple interrupted suture pattern using non-absorbable suture material like nylon or silk. Postoperatively, place a plaster collar on the cut and then keep the cut enclosed or indoors for a few days. Then daily topical application of an antiseptic on the surgical site if infections ensues. Then the cut will be on some antibiotics for 7 days and some pain medication for up to 5 days. Antibiotics include amoxicillin or cotrimoxazole. Thank you very much.